Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Hello, everybody. I'm David Victor. I'm a transplant hepatologist. Cholestatic liver disease is a spectrum of diseases that incorporate primary biliary cholangitis, primary sclerosing cholangitis, but are diseases which affect patients for a long time. These symptoms are often subtle at the beginning and actually missed, as fatigue and joint pain are often some of the first symptoms experienced by patients. Today, we have the privilege of meeting one of my patients who I've known since 2017. She comes to us today to describe her experiences with her journey through cholestatic liver disease and ultimately a diagnosis of primary biliary cholangitis, her journey through treatment, symptoms, and how that's affected both her in her life and through the disease process. So welcome. Thank you so much for joining us.
Hello.
So can you describe to us how you initially presented for your disease, which I think began back in 2015, if not before?
Yeah, I was diagnosed in 2015. The symptoms I had was the fatigue and the joint pain. I had difficulty concentrating and itching, dry eyes, dry mouth, dry skin.
How many times do you think you went to your primary physician with those kind of non-specific complaints before someone began pointing you toward a diagnosis of liver disease?
Well, the fatigue for years, because I actually have thyroid issues. I had thyroid cancer in 2008 and had a thyroidectomy. So I always just blamed it on not having a thyroid and adjusted my thyroid medicine accordingly. And I just became so used to it that I just always just assumed it was my thyroid.
And did the itching accelerate after some period?
Yeah, that started later, like closer to 2015. And it was like the palms of my hands and my stomach would be the places that itched the most. And I had no clue, what the cause of that was. I just figured it was probably something with my thyroid too, because who knows?
And when you finally were tested, what did they do to establish your diagnosis?
Well, when I was finally diagnosed, originally I was actually admitted to the hospital for gastritis, and I had a GGT of I want to say it was like 420, and my alk phos was 176. So that kind of alerted my primary doctor that something was going on. So he ordered more blood work and referred me to a gastroenterologist for a liver biopsy.
For our listeners, our patient has described the two of the blood tests that are classically elevated in primary biliary cholangitis, or PBC. An increase in alkaline phosphatase and the GGT are often seen in these diagnoses. But I think her experience highlights one of the most interesting facts is that the subtle presentation of this disease that became progressively worse and required acute other issues for final diagnosis. Now, once you were referred to the gastroenterologist, tell us how that experience began.
Well, my primary doctor had to fax my records to the specialist, and I'm from a very rural area, so I actually live 45 miles from the town where my primary care doctor is, and there's gastroenterologists there, but none of them see liver patients. So he had to refer me to somebody in Houston. And the first one he referred me to never got back with him. So then they referred me to another one. And they got back pretty quickly, and I was seen, I would say, probably within a month of them getting my records.
And once you saw them, you traveled the probably 3 to 4 hours, I guess would be about right,
Three
to
and a half.
the visit. And from there, tell us about your first experience when you started being told more and more about your liver disease.
He told me that he suspected it was the PBC, and he wanted to do the biopsy to confirm it. And then he also told me that I had NASH.
So she brings up a growing point that we're seeing more and more of, is that patients often are told they have fatty liver or have secondary disease on top of concerns for cholestasis. So a biopsy, which is not required in all cases of PBC, can be done and are confirmatory. I got the opportunity in reviewing your case for this podcast to review your biopsy, and it showed that you did have classic findings of PBC on biopsy with a little bit of fat in the liver, but no NASH or non-alcoholic steatohepatitis, but you already had some scarring or fibrosis in the liver. When you started on therapy, did you understand what the diagnosis of PBC meant?
Not really. I had to research, because I had never heard of it before. So I did have to do some research. And then with that research, a lot of the symptoms, like the joint pain and the fatigue, made a lot more sense. And then I knew that they weren't from my thyroid.
So that's nice to hear that you were able to find those resources for you to help draw your symptoms together. After your biopsy, I think there were some insurance changes and you came into our practice.
Yes.
At the point that we met, you were on treatment with ursodeoxycholic acid, from what I remember, correct?
Mm-hmm. Mm-hmm.
And were your symptoms well controlled?
Not really, no. The urso, it had lowered my numbers some, but it also caused severe stomach issues to the point that some days I couldn't even leave the house.
And when we met, what did we talk about our first few visits? Was it a lot about your liver disease, or was it about your associated symptoms?
It was a lot about my associated symptoms, and I also have depression and anxiety, so we talked a lot about that. You wanted me to focus on that and be in a good mental space, so I had to work on that.
We focused on that because your symptoms were making your life pretty hard and making all of that worse, from what my notes and my recollection was. When we met, I remember distinctly talking to you about why ursodiol was so important. And was there anything that you remember we discussed that made you think how important your medicine was to your disease?
Well, I knew I needed to get my numbers down, because I knew that would probably help me feel better. So to me, that was one of the most important things, was getting the alk phos down.
So for me, in taking care of this, I think it's very important that our patients, and you in particular, knew what our goals were and why our goals were important. Feeling better, improving symptoms, but also improving our numbers, because that's how we improve overall outcomes and prevent people from developing cirrhosis or even needing a transplant. So we both kind of identified that number for you together and began looking at it regularly. Can you recall when we first started obeticholic acid, kind of what that was like for you? That was like in 2018 for everybody listening. So it was quite a few years ago.
I didn't have any side effects. It actually counterbalanced the stomach issues from the urso. So I don't really have stomach issues anymore. So yay. The insurance, we have to get prior approval, and the medicine is extremely expensive. So I also, through the drug company, they have patient assistance. So they contacted you, I think, and got me patient assistance.
And on that medicine, we went back and we've been watching your labs. Can you tell us kind of what the evolution has been while we've been on that for the last 6 years?
Well, I know that my numbers came down quite a bit initially, and then they started to creep back up. And I don't know, for some reason, last May, they were like the highest they had ever been, like over 200, I think like 270 something. And I don't know why. So then we started the fenofibrate, and
we also did the ultrasound that had shown a little bit more fibrosis. So we'd wanted to really get that back on track.
Yeah.
And we had, that was during the period when I looked at mine that we'd had the insurance issues, and it had jumped right back up the alk phos from about 150 into that over 200 range again.
Mm-hmm.
So I think her journey describes what I see in a lot of our patients, is that we get improvement with agents. We have to manage the side effects. We have to continue to engage our patients into keeping their eye on the prize, with the alkaline phosphatase being what we typically follow, but that engagement in their labs. And, she shows you that she keeps her own file system of her labs because they're important to the evolution of her disease, and they're important to her. I am proud to say that with 3 agents, recently, the labs have looked the best they've looked in quite some time. So I'm happy to say that the evolution of treatment seems to be working, but it is taking all of the medicines we have at this point. As you've incorporated all of these medicines and having to take medicines twice a day for this long, what has your experience been with taking these medicines? How have you incorporated it into your life?
I've been on thyroid medicine and blood pressure medicine and antidepressant for years. So it's just a matter of adding the medicines, for the morning or the night. So it wasn't that big of a deal to me because I was already on medicine.
How's your fatigue been throughout this experience? Have you noticed any changes with any of the medicines or treatments?
Well, yeah, it was better until 3 years ago. And then my depression and anxiety increased and my sleep cycle got way off. And so I still have trouble sleeping. So the fatigue is, especially on the nights that I don't sleep very well, the fatigue is really bad, but I just push through it.
I think what's very telling about you in particular is that treating your PBC was still important despite everything that went on to you. Why do you think that was still important despite all of your experiences?
Because I have 2 children that I need to be here for, because that's the main thing. My life is important, not only to, for them, but to me. I would like to be here a long time. I want to see my daughter get married. I want to see my son get married, and I want to see both of them graduate from college. And I want to be here for a long time. So
in PBC, we know that the more effective the treatment, the more that patients are able to have a normal lifespan. The less effective the treatments, the more likely they are to have liver-related problems. So she and I have talked extensively about how important it is to get your alk phos under control. We've added medicines over the years, increased doses, but continually fought to do the best we can to treat the disease that she has. I think it's a testament to how this disease requires an active participation by your patient, my patient, by yourself if you have it, but continued involvement in your treatment is important. I'd really like to give you a few minutes to talk about what you wish you had known when you were diagnosed with PBC, and what you might tell others who are struggling or dealing with this disease, some tips or strategies or things that have helped you manage your own disease.
I wish it would have been, there's no control over this. I wish it would have been easier to diagnose me sooner, because I think probably if I had been, I mean, I don't know that it would have made a difference, but maybe my symptoms wouldn't have gotten as severe if there was a way to have been diagnosed sooner. But yes, more education would have been good.
And for that education, where do you feel that would have been most effective? Coming from your physician, or from providing resources to read, or putting you in touch with another PBC patient?
Probably from the physician, I think, just because they would know if the information was accurate, the information that I'm getting is accurate, because, if you go online, there's so many things that you read that you don't know if everything in there is correct. And then you go down a rabbit hole and everything freaks you out. Because I know whenever I was first diagnosed, obviously I was scared, because I was like, how is this going to affect my life expectancy and my quality of life? And was I going to need a transplant? Was I going to get cirrhosis? Because, I have a family history of cirrhosis with my dad, which we don't know what caused his, and he had to have a transplant. So those were all things that went through my mind whenever I was first diagnosed.
And when we met, I started focusing on trying to get you to look at treating everything in your life, both the depression as well as your liver disease, because the fatigue that you have was really the most profound symptom. Well, I really appreciate you talking about your experience with PBC. Is there anything that you'd like to say to somebody out there who may be in the process or in their journey with PBC as well?
Well, yeah, it's really a learning curve as to what combination of meds works. And so you can't get discouraged, because, I've had fluctuations with my numbers. And I also think that you have to have a really good relationship with your doctor. You need to feel comfortable with them, that you can talk to them about how you're feeling, and be completely honest with, how you're feeling and what your symptoms are. And you want to feel like you're actually heard and not just another number, which I feel that way with Dr. Victor. He takes the time, he listens to me. There was one visit that I went, it was after the anniversary, right after the anniversary of my husband's death. And we spent most of the visit talking about not my liver stuff. It's important that you have a relationship like that, where you can talk to them, and they will spend the time with you and talk to you, even if it's not related to, specifically related to the PBC. If you're having an issue, you should feel comfortable enough to be able to talk to them about whatever that issue is, in my opinion.
Well, I'll say that I'm a little selfish, because I want you to be a steward to your body, yourself, and your liver. And I think that if you don't make sure that you're okay, then taking care of your PBC becomes secondary, and we worry about you. I want to tell you I'm proud of you for your journey through PBC. It's been a lot of different iterations in our relationship together, but you've done a great job navigating, being an advocate for yourself. And I really do appreciate you coming on today and talking about your experience.
Well, I appreciate you thinking of me, and I appreciate your care, and I'm glad that you stay up to date on all the latest research, because I think that's really helped in my situation.
Thank you very much.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.